Hi everyone, this is John and Glenn, Best Price Nutrition. Today we're going to cover bariatric surgery protein. We get a lot of people who've gone under the procedure of bariatric surgery, and we get a lot of questions, what can I take, what should I take, or a lot of the times the doctor tells them, take nectar from Syntrax. That's the most common one that you hear, I hear, and a lot of that I assume is because it tastes good. If you like that, it's a very sweet protein. They've got a few different varieties of it, but the main point here is that it's a whey protein isolate. Whey protein isolate means that they've pretty much gotten all the lactose and all the fat out of the protein, so it's very easy to digest, very light on the digestive system for anybody, and it's most people don't have really too many allergies to it. Nothing really in there that's going to cause any kind of an effect that would make it such that you wouldn't be able to take it. Like I said, nectar is probably the most popular one that we have, and a lot of the times it seems like that's all that a lot of people are willing to try that bariatric surgery, but we're going to tell you there's a lot of others that you can take. You could really open up your palate to some other flavors out there because nectar, while the most popular, certainly isn't the only whey protein isolate out there. In a previous video, we talked a little about whey protein isolate. You want to run by real quick some of the...
Yeah, essentially, like John had said, it's just all the lactose and fat is removed. It's a very fast-absorbing protein. Can be used for post-workout, things like that. Generally should absorb within half hour to an hour. It's better suited as something you would use throughout the day or around the workout. The cool thing, or the good thing about it in terms of bariatric people is that it's very light. This will mix with water. You can mix it with a spoon most of the time. It's not very filling because you don't have a lot of room for all those calories to come in and for a lot of solid food. And it's just straight protein, which is nice because that's a really hard thing to get when you are a bariatric patient, is to get the protein in.
And some people like to blend ice cubes in there too to kind of give it a little bit more of a a different feel, give it a little bit different taste. I assume over time a bariatric patient can start adding like frozen fruit in there to kind of spice up the taste and stuff too, but obviously, check with your doctor first before you do anything like that. I personally wouldn't see why there'd be an issue with that. But that being said, we're just going to run through a couple of these. Now, this is Isoflex from Almax. This is a relatively new line that we brought in. They're out of Canada, and it's very good. The taste on this stuff is phenomenal. They've got chocolate peanut butter, chocolate mint,
strawberry,
and vanilla.
Yeah,
and that's in the regular Isoflex, and then there's also the Iso Natural, which literally, if you look at the ingredient, the only ingredient on here is whey protein isolate. So there is literally nothing else added to it. It's a natural flavored thing, so this would be something that you'd want to add fruit to give it a little bit more taste.
Mix it with orange juice or any kind of juice, something like that.
If you're looking to avoid the calories, you could do it with something like Crystal Light, maybe like a lemon taste, and you can make your own lemonade as opposed to nectar, which they have a lemonade flavor, but let's say it's a little too sweet for you. Well, you can dictate how sweet you want it to be based on how much Crystal Light or something like that you want to mix with it. You can make a fruit punch, so you can kind of use your imagination with the flavor. Great thing about both of these is they're pure whey protein isolates, and they're both derived through cross-flow microfiltration, which is pretty much the gold standard when it comes to whey protein isolates. There's ion exchange where they're exploiting charges to separate the protein from the fat and lactose. There's microfiltration, ultrafiltration, cross-flow microfiltration. So it's done at a low temperature, which keeps the protein intact. You don't denature the tertiary structure, which is very important. Another one over here on the end is InterPro. What do you think about it?
Yeah, essentially this is it adds a little bit of fat to it. It's healthy fats. It's going to have more of a creamy taste, almost like that milkshake kind of a taste. That's the main difference with this one. So it does have a little bit extra calories. I mean, you compare this 155 calories, and I think this is 100 calories. So it's got like 55 more calories, and the main reasoning is it's adding a little bit of healthy fats.
3.5 grams of fat, 9 calories per gram. So right there's 30 some odd calories, which would make the difference. And I think the protein per scoop is actually a little bit more too.
It's 25 grams, and then this is 24 grams, and these are both, this is 28 and this is 27.
So, and that's just based on how much powder you actually put in there. You can measure it however you need it to be, but pretty much just the theory here is that we're opening up the window to bariatric patients, that there are other whey protein isolates out there that you can definitely try. That if you've had no problems with nectar, there's not really anything I could see having an issue with really any of these, especially the Isoflex. The sweeteners, they actually use a little bit less. The nectar for me personally is a little overwhelming. It's a little too sweet. It's too much for me. So that's why I like the Isoflex. However, the nectar is very, very popular because of the taste. So If you guys have any questions or comments, please go ahead and put them in the bottom of the videos. We're happy to answer them. We try and answer them promptly. If you got any other concerns or anything, please just post them up there. We'll try and answer them. Thank you.
Thank you.